Petworking is presented by Maya Strategy Group, a leading market research and strategy consulting firm, helping clients in the pet care and animal health industries navigate strategic challenges for almost 2 decades. Hello, everyone, and welcome to Petworking. I'm Peter Kenseth, Vice President and Partner at Maya Strategy Group, and I'm here today with Dr. Chrissy Fernandez, Dr. Christina Fernandez, Dr. Chrissy of Chewy's Connect with a Vet program. Dr. Chrissy heads up the program, which just had its 1 millionth telehealth consultation. So we're excited to have them on and talk about, how in only 5 years you were managed to serve 1 million customers and help 1 million pet parents through various issues. Really excited to talk about some of the cases that you're seeing with televet and explore televet more broadly in general. But Dr. Chrissy, thank you so much and welcome to Petworking.
Yes, Peter, great. Thank you so much. It's awesome to be here. I'm super excited to talk about what we're doing at Connect with a Vet. I've been a veterinarian for 18 years now and come from a varied background, everything from emergency critical care to working in universities, teaching vet students and, supporting pet parents, some shelter work. And so this kind of the last 5 years I've been with Chewy on the Connect with a Vet team, and it's just been really amazing to see what we've built here. So I'm super excited to talk about it.
Yeah, no, I'm super excited to hear about it because, I think we think about, televet a lot, and I think it's a tool in the toolkit that a lot of pet parents forget that they have access to, right? I think for so many things, and I'll speak from personal experience as a first-time pet owner. I've had Peony for 8.5 years now, but she was the first dog I had, and I certainly would not have made it without accessing televet services and the advent of Google Home and being able to ask quickly about what foods my dog could and couldn't eat, and if she ate something off the floor or things like that. But I think one of the huge advantages of a televet program is that you can get that quick peace of mind. You can get that initial consultation without having to, God forbid for the cat parents out there, put your cat in a cat carrier or, get your dog out into the car if you can even get an appointment. And I know we were talking ahead of this episode that Connect with a Vet was kind of born out of necessity during the pandemic. And we still continue to see to this day forecasts of veterinary shortages across the country. And so even in areas that are well served by vets, it can be difficult for people to get appointments. Probably not as difficult as it was when you guys started back in 2020. But then there are also areas of the country, the veterinary deserts where people have to drive hours to see a veterinarian. And so, being able to address concerns from the comfort of your own home, I think is just a huge advantage. And I'm excited to see, really excited to hear that you've hit your 1 millionth customer. And but talk us through, what brought you to Connect with a Vet, and talk about your journey getting to Chewy, and then maybe take us through the program's evolution over the last 5 years.
Sure. Yeah, happy to do that. I think if you ask any veterinarian where they thought or they were going to end up in their career and what they thought they'd be doing, most of us, when we go to vet school, it's because we have a vision, right? We're going to be some version of James Herriot, working in a clinic, helping animals, helping people, and all the things. And that was certainly my story too. I've always had a passion for helping people and pets, and that stems from a young age. And when I went to vet school, at first I thought I'm going to be an exotics vet. Go zoo medicine all the way, exotic animals. I found them very interesting. I thought that would be a really neat way to develop myself professionally. And then the further I got into veterinary school and my first couple of years of practice, I thought, oh my, no, I really like dog and cat medicine. Like small animals is where it's at. I'm going to shift gears and then really got interested in supporting patients that were critically ill, trauma patients with multi-system complex diseases, patients that were poisoned, things like that. So took my career in the emergency critical care route, completed a residency in emergency critical care, got board certified with the American College of Veterinary Emergency Critical Care back in 2013, and spent a lot of my time in private specialty practice and in academia. Loved sharing that knowledge and training with veterinary students, helping them develop themselves. And, throughout all of that, one of the things I loved the most was trying to find a way to help people. When you train, especially if you take the path of doing a residency, you learn all the ways you can help people, from, simple solutions to ultra complex, and delivering veterinary care is really about what we can do and what the pet parents can do as well, right? And trying to find that happy middle ground. And so as I started to think about, the next steps for myself professionally, started to think outside the box. How can I take all of this learning, the skills, knowledge, and apply it in a different way? And that's when I learned about Chewy, starting this program called Connect with a Vet. And I was like, oh, telehealth, that sounds neat. I like the idea of that. And so came on board in the early days. We launched Connect with a Vet in October 2020. I was one of the first couple of veterinarians that joined the team back then. And, it was really born out of a need. Obviously, as you mentioned, that was during the time of the pandemic. And so people weren't able or weren't willing to leave their homes, but pets still needed care. Pets still got sick or they did weird things. And people didn't know, is this normal? What can I do? I can no longer just rush out the door to my vet's office. And so, we at Chewy, one of the things that's always at the forefront is trying to deliver services and build things that help meet our pet parents where they're at. And this was the right solution for us at that time. And it's continued to be the right solution, especially as millennials and Gen Zs are becoming, the principal pet parents out there. They want information at their fingertips. And so with Connect with a Vet, we can help with that. As you said, you're going to Google and you're doing all the things to try to find quick answers on the fly. And, we can help meet that need and do it better because you get access to a live veterinary professional right then and there.
Yeah, absolutely. And I mean, it's amazing to think, just how far we've come in, the pandemic really was a black swan event. I mean, if we think about even just video conferencing, I mean, here you and I are recording this podcast on Zoom today. I think back to before the pandemic, I would almost never have video conferences with my clients, with my colleagues. It was all done via the phone. I've worked remotely since 2013, so that part wasn't new to me. But what was interesting was this transition and acceptance of video calls and communication that came about as a result of the pandemic. And I think, it wasn't like televet wasn't a thing before the pandemic, but I think it really accelerated it. And like you said, it pushed it into the mainstream because necessity is the mother of invention. But I'd be curious, you were taken with this. I hear a lot of vets talk about, no, I really need to get my hands on the patient, right? I need to be able to do that in-person exam. Do you feel like vets sort of evolved during COVID to, just be accepting of the fact that like, okay, this is, another tool that I need to add to my toolkit now? Or how do you see, is that an issue when you're bringing people on to recruiting for the program? How do you overcome that barrier?
Yeah, that's a great question. I think, to help answer that, I'm going to tell you a little bit more about how the program works, right? And what we do. And so at Connect with a Vet, we offer triage advice and support for pet parents, right? And so the way we work, we have veterinary professionals, veterinary technicians, veterinarians. Pet parents can use our free chat triage service anytime they want. We're here 7 days a week, 365 days a year, 6 a.m. to midnight, right? So we're here most of the waking hours that pet parents are wanting to ask questions. And they can ask any question they want. And what they'll get is advice personalized to their situation where, we'll ask questions, get to understand what's going on. What are you really concerned about? What are you seeing with your pet? Share some more with me and try to help them understand maybe what are the best next steps. and they'll get recommendations, educational resources. And so to your question about, do I need to get my hands on the pet? What do I need to do? Well, in this scenario where we are trying to help someone be better informed, make a better educated, decision around what do I do next? Do I need to rush out and go to that veterinary ER right now? Can I wait until my vet opens tomorrow? Can I monitor at home for a little bit? That's where we come in. We come in to help people kind of give them some more information and advice on what they can look for. So is it a replacement for that hands-on clinical exam? Absolutely not. People, and in fact, often over 70% of the pet parents we interact with, they get a recommendation to follow up with in-person veterinary care. And we're emphasizing the importance of making sure you have that relationship with your physical in-person vet. And so I think, we really serve a neat niche there for folks because we're there when maybe their vet isn't. We can help them live rather than them being lost in the depths of Google. And we can help them, make that decision when they're on the fence or there's anxiety around, what they're seeing and they just don't know. So I think it serves a really neat purpose for that.
Yeah, no, and I completely agree. I was asking more from the perspective of, the type of vet that, finds themselves transitioning into
Mhm.
televet services. But you raise a great point that I wanted to ask you about. So you have the free chat service that anybody can use. So you don't have to be, part of Chewy Health. You don't have to have Chewy pet insurance. And then you also have a paid video consultation option, correct? So talk us through the differences there. As I understand it, the chat is manned by vet techs, and then to consult with an actual veterinarian, you have to do the video conference.
Yeah, we have both. So we have veterinary technicians and veterinarians who are there and available through our free chat service. And then we do have the video consultation offering that is dedicated time with a veterinarian. That is a fee for service kind of basis. And yeah, you schedule it by appointment and then you get that 20 minutes with a vet, which is really nice. And a lot of our customers, when they use that service, it's because, a lot of them have a relationship with a veterinarian. And again, we encourage that greatly, but there's only so much time during an in-clinic appointment. And you get a lot of information from your veterinarian during those appointments. And sometimes your questions, you don't think of them until after you leave. And then maybe, you feel silly calling, or maybe you're waiting for a call back and you just want that answer now. And so again, that's where we can kind of serve a really nice, give a nice service to them. And, to your earlier question about how this works from the veterinarian's perspective, most of our veterinarians, when they transition over to this type of work, one of the things that comes out when we talk about what do you like about this role, what do you feel good about? It's, man, I didn't realize how much I loved educating pet parents. And I didn't get to do as much of that as I wanted to when I was in my clinical position. And now I get to spend a lot more time emphasizing the educational part of things. So it's really brought around this other facet of the profession that people kind of forgot they loved and what kind of enthused them in the first place.
Yeah, no, I mean, it makes total sense. We did an episode very early on. I think it was definitely one of our first 5 episodes with Dr. Frank DeCecco, who has DVM6, which is a relief televet option. So he contracts with clinics to take either their excess cases or maybe provide after hours support. But he mentioned, that there's this really great benefit to it for, keeping sharp veterinary minds in the profession and kind of reinvigorating people's passion for doing veterinary medicine, because, we all go through phases of our career where we're burnt out, we're tired, we need something new, we need a different challenge, and obviously there are the physical demands both for vets and vet techs of being on the floor in a clinic, lifting up, 80, 100-pound dogs every day. And as you pointed out, you're on the clock, you got to get patients in, get patients out, and, you may not have enough time to sit and talk with every pet parent. And so, I think that's obviously we focus a lot on the benefits of televet services, to pets and pet parents, but I think there's a huge benefit to veterinarians as well. And when we think of the issue of veterinary burnout, being able to transition, both for vets and vet techs, transition into telemedicine can be a great way to let people reapply the skills that they had and reinvigorate their passion for the profession.
Yeah, I think, caregiver fatigue, compassion fatigue, it's real. It's real for human medical professionals, and it's certainly real for us as veterinary professionals. And having the option to work virtually is really nice. And I think that fatigue and that burnout can stem from a lot of things. You mentioned a lot of them, right? The physical stress of the work. Sometimes it's not the physical stress, it's the mental and emotional stress as well, right? Pets, every pet is attached to a pet parent. Every pet parent has their own, constraints and ideals and things that they can do. And then it's not an easy journey for anyone. I think some of us, it just depends on what we're passionate about and what motivates us. I think for some veterinarians, my husband's one of those. I use him as an example all the time. He's also a vet, and he'll be in the clinic till the day someone forces him to retire. He hands-on is where it's at. Does he have his hard days? Absolutely. For me, I was interested in taking a different path, and I've equally found job satisfaction through the work I do here in the virtual space. And what's nice about Chewy is that we offer both of those options for veterinary professionals, right? We have our physical clinics, Chewy Vet Care, that we opened last year, that allows people to come and pursue their passion as veterinarians, veterinary technicians in the hands-on clinical environment in a very purposefully built clinical setting, right? With the team member in mind. And then we have Connect with a Vet, where, hey, yeah, you're looking for something a little more maybe flexible or remote. Maybe you want to try work from home and that works with you and you're trying to balance what's going on. We've got that too. And so I think it really depends on what people need in the moment. And those needs, sometimes they're permanent and sometimes they change.
Yeah. No, and it's so nice to, because I think this is something that's evolved to like let people, realize that there is more than one path. It's not just being in the clinic. It's not, you're not trapped, so to speak, right? You can find that outlet that allows you to leverage your skills and, fulfill the, like you mentioned with, finding the joy in educating pet parents, right? I think it's great. I'd be curious. 1 million visits. So over the course of 5 years, we're 200,000 a year. So that's a lot of consults. How many are coming in through the app? How many are video consults? And what's the breakdown? How many are just like routine, check-in advice questions versus you mentioned, in critical cases and you're helping people try to find an emergency vet. How many of those are you?
Yeah, it's a great question. I mean, 1 million consults. It's crazy to think about. For me, especially being here since Connect with a Vet launched, not even 5 years later, it was March that we celebrated our 1 millionth consult, and that was a really really neat scenario. Our 1 millionth customer was actually a Chewy customer named Casey, who chatted in about her pet cat named Fish and her questions. She wanted to know. She had some concerns about Fish's body condition. Was Fish, overweight? Should she be concerned? Were there things she could do? This was more of along the lines of what we would consider a nutrition focused type consult. And it was really neat because by the end of it, I think Casey walked away feeling pretty empowered that she had some good information around how to look at Fish's body condition and what questions to ask her vet about nutrition and food and her feeding plan. But we talk to people about a variety of things. Some of the top reasons people use our service are to ask questions about skin issues and digestive issues, which is not that dissimilar from some of the top reasons people go to their general vet, right? I mean, if you ask most veterinary clinics, I think they'll say GI issues, vomiting, diarrhea, questions about food and diet are one of the top things that we see people with their pets for. Skin issues certainly as well. And in those cases, it's really nice because, again, we get to dig in and lean in on the education. So with a skin case, for example, we can take time asking, what are you doing for flea and tick prevention? Has your vet recommended anything? What have you tried in the past? Does your pet, we will dig in and ask questions about symptoms they're seeing. Are they seasonal? And ask them, have you talked to your vet about the next steps? Your vet maybe is recommending some skin tests. Maybe that's something that you need to think about doing. Have you talked about seeing a veterinary dermatologist? And so people, again, they walk away feeling empowered. In some of the more critical cases, people will often use a service like ours and ask questions about toxin exposure. I'm concerned, my dog just ate this. Should I have should I be concerned? Do I need to do anything? My cat was exposed to this. And, for that, we have a really nice partnership with Pet Poison Helpline, where we are able to kind of triage those cases through our chat or video service, and then make an offer to the pet parent. Hey, would you like to consult with our partner, Pet Poison Helpline? They're the experts in toxicology. Let's help you get over to them in that service. So yeah, we help with all problems, big and small. And we've done it for over 1 million of them now, which is just really phenomenal.
Yeah, no, I mean, it's staggering volume. I mean, I'm looking at the Chewy website right now, and Connect with a Vet is on the services drop down. Where do you guys have data on like where most pet parents are finding Connect with a Vet? Is it, do you have any relationship? I know, you do the Care Plus insurance as well. My pet insurance company that I've had since I got Peony, they actively market like, hey, as part of your pet insurance, you have access to this televet line. And it certainly has been super helpful for me to be able to call into that line when I've had questions, when it's after hours, when my vet's closed. Do you find that people are just organically finding Connect with a Vet through a website, or is it, coming from, the insurance side of things? What's that breakdown look like?
Yeah, I think honestly, it's a good mix. I mean, certainly, we do our fair share of marketing, and people can discover us quite easily. If you Google online chat with a vet, I mean, you're going to see Connect with a Vet come up. And so I think we are getting those folks who are trying to go to Dr. Google or don't know what to do. You mentioned pet insurance. Of course, Chewy has Care Plus. We do have that. And, there is a benefit for Care Plus insurance plan holders that they can utilize our Connect with a Vet service as well, especially the video service. And so, I think there's a bunch of different verticals. PetMD, obviously PetMD is owned by Chewy, and that's our pet parent educational content portal, right? Where people can go for everything and anything pet related to educate themselves. And a lot of our Connect with a Vet veterinarians are writing those articles and are involved with the content that's going on that site. So I think pet parents are getting exposure to Connect with a Vet from a lot of different angles.
Awesome. That's awesome. I mean, it's so cool. And I know we probably don't want to go too far down the VCPR rabbit hole, but going back to for folks that, and pet parents who may be listening who aren't in the pet care and animal health industries, VCPR kind of dictates the level of advice that you're allowed to give in televet services. You can't prescribe or make definitive diagnoses or recommendations unless you have that physical relationship established with the pet. I know during the early days of COVID that VCPR, a lot of states suspended that in response to the condition that we are all living in, and now we're kind of seeing some states keep that open, some states tamp down on it. Do you feel like that has affected your ability to, how has that influenced your ability to grow the program? And
Yeah, no, I think it's a good question. I mean, the landscape's always changing all the time, right? But our focus at Chewy and with Connect with a Vet has always been on delivering excellent telehealth advice and triage through Connect with a Vet. We're also focusing now on driving high quality in-person care through our CBC clinics. And so I think, with that in mind, we're going to continue to listen to what our pet parents need and be focused on what customers are expecting and looking for, and keep tabs on that and evaluate over time. But Yeah, telemedicine is a huge discussion point right now in the industry, and with the changes in VCPR, you want to stay on top of that. But for us as an advice and triage service, that's what we've stayed focused on this whole time. And that's not wavered. And that's allowed us to continue to grow and deliver that high quality care to pet parents through our service without, as you mentioned, crossing over into those areas of diagnosing, prescribing, giving personalized, care plans.
I mean, it's so important, even just from a triage perspective. And you mentioned earlier that you have 70% of cases, ending in recommendation to go and follow up with your vet. Obviously, you want to be safe rather than sorry, right? So I'm sure that's part of why that number is so high. But at the same time, like, we see the issues of, people not bringing their pets to the vet and, not getting, appropriate, preventative diagnostics, not getting, that annual wellness check. And then down the road, you run into a situation where you're treating a condition that's probably far worse than it would have been had you maintained, a regular relationship with your vet and gone in more often. How do do you just connect with, obviously now that you have CVC kind of starting up and, and connect with the vet has, long predated that. Do you see that kind of changing? And, obviously Care Plus, it all kind of revolves around that ecosystem of getting people into the vet more often and resulting in better overall health for our pets. Where do you see Connect with the Vet in that pillar? And how many is that part of your mission, with the program to get more people into a physical vet more often?
Yeah, our mission is to increase accessibility to care, right? And we do that primarily through education. I mean, gosh, we could probably talk for an hour on all my favorite cases that I've, consulted on over the years through Connect with the Vet. But it really is, it's truly amazing, right? I mean, we have people, as you said, who either aren't going into veterinarians because they can't afford it or they can't access one. I once consulted on a case with someone who lived very remote. They were about 3.5 to 4 hours away from the nearest veterinarian, and they were worried that the pet started paying attention to the rear limb, licking the toes a lot, just acting funny, and it was very abnormal, and they just didn't know what to do. But they were hesitant to make that 4-hour trip for something minor, so they needed advice. We chatted for a while. I asked questions, got to know a little bit more about this particular pet's, history and background. Well, this was an older dog. It was a breed that potentially could be predisposed to developing some more complex diseases, including even cancers of the limb. And so we talked about it, and I gave some education. And I said, look, here's what I would do if you were calling me. This is the advice I would give you if I were in a clinic physically. I think you should go see the vet. And we got really nice follow-up. It was a little bit of a sad outcome for the pet, but a really nice follow-up from that pet parent a couple of weeks later saying, thank you so much. Without your help, I wouldn't have been as inclined to make that long trip, and we needed it. Turns out her dog had cancer in one of the bones of its toe, but they caught it very early. They were able to pain manage and help that pet live comfortably. And so she was really grateful, so things like that's why we're here and why we've continued to do it in the way we're doing it. Having CVC, our Chewy vet care clinics, having our Care Plus insurance, that's just the extra way that we're, essentially wrapping our arms around our customers all the way. We can help you wherever you need the help when you need it. And so that's why we're staying focused on that mission of, education is powerful. People don't know what they don't know.
It's certainly, I mean, it's a big part of why I started this podcast is because I feel like, for so many pet parents, they're adrift. They don't know, what they don't know. They may not be going to the vet super often. They may, their knowledge of what to do with their pet may just be limited to that interaction with their vet. They may not have resources to advise them on potential therapies or potential diagnostics and things like that. And so, the more we can bring awareness to, there are resources out there that you can access as a pet parent that will make you a more responsible pet owner. I think it's only going to help. And, we all want longer, happier, healthier lives for our pets. We only get so much time with them, and, you want to make it as good as you can. Um, I'd be curious, and you said we could probably talk for an hour about your favorite cases, and that was a very compelling one, albeit a bit of a sad outcome. Do you have any examples of cases, where you've gotten somebody to go into the vet and it made it, you've gotten follow-up that it's made a difference, in terms of extending life, or, catching something that would.
Yeah, absolutely. We have, yeah, well, another one of my, I think you ask any veterinarian, I mean, all of our patients are extremely important to us, right? But you have that list of cases that kind of just sit there that you always remember, right? Either because they were a really crucial learning moment for you as a veterinarian, or they were just part of your professional growth. And in the early days of Connect with a Vet, we had another customer who chatted into us about their German Shepherd, and they were seeing some things that were abnormal for the shepherd. This was a dog that they used for breeding, and so they had questions about the reproductive stuff that was going on with the pet. And we again asked questions, tried to understand what exactly they were seeing, what was the timing around when they started seeing things, and they were inclined, they were looking for reassurance that it was probably okay to just sit and monitor. But based on the information they shared and what they were seeing, we were like, yeah, this is something that needs examined, because again, and it's about finding the right balance. You don't want to alarm people. We're not here to cause more anxiety. We're here to help reduce that. But again, making an informed decision, there are some things that could be a little more serious. Well, this dog, it turned out, had an infection in her uterus, pyometra. She had to go for emergency surgery. And so we got a nice follow-up from that customer as well, saying, thank you so much for encouraging me. I wasn't going to go to the vet, and you saved my dog's life. Had we not done that, we would have sat on it and it might have been too late, or it might have been a more complicated surgery with higher risk. So, again, education is powerful. And even with people who, this was a highly educated pet owner, they knew very well about what they were seeing, but they needed that extra reassurance.
How, in how many of these cases, I'm always curious, because I think one of the biggest barriers to care for a lot of people is pet insurance. And, obviously Chewy offers it. You guys have Care Plus, but, um, it's a big passion of mine, because I struggle to understand, how we can sit and have 3 to 4% adoption. And I think for a lot of people, because there is that financial barrier to knowing, like, oh, if I go in and I don't have pet insurance, I could be looking at, a very expensive vet bill. You know, Surgery isn't cheap. It's, you're probably looking at a minimum of, $5,000, right? And I'm sure in that case, that's probably what that pet parent was afraid of. Have you noticed, um, either in terms of use of the service? I know you mentioned, Care Plus members get access to the video visits that otherwise, if you weren't a member, you'd have to pay for. Have you noticed any difference in usage of televet from insurance customers versus non-insurance customers, and their willingness to kind of seek follow-up care?
Sure. Being quite honest, that's not, I mean, sure, we have that information. It's not something that I necessarily track closely. I think, we always embrace an opportunity to educate people that pet insurance is available and it exists. And, some people will come with questions about that. And then, we have the nice ability to be able to say, hey, would you like me to transfer you to someone that you can speak to about Care Plus directly? Because they can do that, right? And then they can speak to a licensed customer service agent who can talk to them about all the details of their plan.
Right.
But in absence of that, I think it's, again, people are just trying to understand, what's the value to me? Is it worth it? Is it really going to save me in the long run? And so we try to have our part in educating around that too. But that depends on whether they bring it up and on what their specific questions are. I think we do get our fair share of people coming that using the service that have pet insurance, and you get a lot of people who still don't. As you said, the adoption rate is slow, but we're getting there.
Yeah, and I hope it continues to grow. I mean, the number of people that I've had in the course of my career who um, know that I work and consult in the industry, and they come to me and they say, "Oh, I just got another $4,000 vet bill," and I look at them and don't you have pet insurance? And they either don't know that it exists, or have this misperception that it doesn't work. And I think it's a crucial barrier we've got to overcome to continue pushing veterinary medicine in this country forward. Um, but like you said, not everybody can afford it. And I think, that's the beauty of having a free televet service, is that you are making it, accessible to everyone. People can find, you know, Chewy, connect with the vet. They, at the very least, can chat with somebody who, can give them a chance to um, do the right thing by their dog or cat. Or do you get calls for, other, guinea pigs or birds or reptiles, things like that?
We will occasionally from time to time. Our service is for dogs and cats at this time. And so, but again, we're always about trying to find a way to help. So if someone finds their way to us, we'll do our best to try to get them some resources. But we are primarily focused on dogs and cats. Did have someone chat in once about their 200-pound tortoise, which was interesting.
Wow.
Yeah, and as veterinarians, I mean, we train on everything in vet school. Usually, when we
Yeah.
graduate, we go into practice. We narrow our focus on a certain
Mhm.
species, but we've got a great team, and we've got people with a variety of backgrounds. And so, if someone occasionally does stumble in with a hamster or a guinea pig, we do our best to try to get them some resources and help them out. But dogs and cats are where we're focused right now.
Sure. And interestingly, I just did an episode with Hills that's going to be coming out soon about their World of the Cat report. And we, Dr. Christina and I, we discussed the lack of cat focused veterinary specialization. She was saying, only around like 5% of vets choose to specialize in feline medicine. Do you guys have cat specialists on staff?
Yeah, it's a great question. We have a couple of veterinarians who have specialty backgrounds, like myself with emergency critical care, because there are discipline specific specialties and there are species specific specialties. We don't currently have anyone who's board certified with the ABVP, which is the Association for Feline Board Certification. But we do have a lot of veterinarians whose practice was limited to feline medicine, or whose practice included a focus on feline medicine. So that's certainly helpful because cats are not small dogs. They are their own creatures and they like to do things their own way. And so it is important to be extremely aware of the nuances and the differences in cats versus dogs. And I think we do a really good job of that.
That's that's good to hear. It's really
Yeah.
cool. You know, I'm just imagining, in a typical day, do you find like, if there's an emergency case, will that get routed to you because of your specialization? Or if you get somebody who's, calling in with their cat, would you pass that to one of your colleagues who focuses on feline medicine? Is that, or how does your triage and case assignment process work?
Yeah, I mean, we operate very, I would say you could compare us similar to how a general practice would work, right? In the cloud. So we have our set of vet professionals working, our technicians, our vets, and pet parents will come in. It's kind of on demand and first come, first serve if they're using our free chat service. So as they come in, they'll get connected with whomever is available on our team. In most cases, anyone on our team is able to help because again, we're focusing on triage and education and advice and do, I think, a great job when we bring our vet professionals onto the team to make sure they feel comfortable that they can give good, well-rounded advice in most situations. Sure, occasionally, if there's a specific question or something that a pet parent wants to discuss at a level that's maybe beyond what that particular vet professional is comfortable with, if there's someone else working at that time that could better help them, we'll do our best to connect the pet parent with them. Because again, we're all about trying to give our pet parents the best service we can, and that may be what's best for them in that moment. So we kind of, it's a lot of teamwork. And we come together and try to support them best we can.
Yeah. You mentioned, that the training and just drawing a parallel, and thinking back to my conversation with Dr. Heather at WVC, she mentioned that, for vets who are opening a new hospital, I think it was like a 7-week training process. Can you talk a little bit about like the onboarding and training process for Connect to the Vet?
Yeah, I'm really proud of our onboarding and training process. Actually, it's something that we've spent a lot of time on and have grown over the years. We have what I'd say is probably a pretty rigorous onboarding and training. Some of it, of course, is going to be systems based in the beginning, where your world is virtual now. In a clinic, you had to learn your PIM system or your software, and then everything else is hands on. Well, here you have to not only learn our system, you've got to learn how to access all the digital resources and all the tools and in the interface and the video stuff. And so we have that. But yeah, we have a 90+ day onboarding program. We put our vet professionals through with professional development. We focus on providing CE for our team. We work a lot on that with our team to make sure that they're always growing, that they're getting educational content and training in areas where we know pet parents are using our service. Skin issues, GI issues. Are we staying on top of the newest? Even though we're not prescribing medications, is our vet team aware of what's out there? So when someone comes to us with a question or they mention something, we're educated and able to talk with them about it. And a lot of our vet professionals still do some work in clinical practice as well. So they are keeping that part of their skill set and training up to speed and active.
Just provides them a little bit more flexibility. Maybe they only have to be in the clinic 1 or 2 days a week, and they get to be at home,
Yeah.
more often, can travel a little bit more than if they were tied to a particular clinic. And yeah, no, I mean, it's such an awesome model, and it's, you know, I'm personally grateful, that we live in a time where, these technological advances exist to give people that flexibility to work how they want, where they want, in the environment that best suits them. Um, Dr. Chrissy, do in terms of like talent acquisition and recruiting, obviously, we're facing, a projected shortage of, I think the Mars report that I've read said 31 will be short 31,000 vets by 2030. Have you experienced any challenges in getting people, to connect a vet, or because, people may be leaving clinical practice and coming to telemedicine, has that been a less of an issue for you?
Yeah. I mean, I think just speaking to the, predicted or projected shortage in general, I'm glad our profession is trying to hit it with a multi-pronged approach, right? We're seeing more and more vet schools opening up and become AVMA accredited all across the country, which is helping. We're seeing a lot of different initiatives, but, for us, as I mentioned, a lot of our team members continue to work in clinical practice as well. And, they're looking to do this work for different reasons. Some of them are just interested. They're, as you said, this is high tech times, and they're interested. Like, they want to know, what does this mean? What does this look like? And they want to dabble and learn. For others, they're taking a break from clinical practice with the intention to go back. And for some, they're looking to just transition out, right? They've done their 20+ years in physical practice, and now they're ready. They're not quite ready to give it up altogether, but they want something different. And so I think for that reason, we've been able to continue to recruit and meet our needs. Our team's grown over the 5 years, that's for sure. But no different than any other practices recruiting challenges, right? It's got to be the right fit for both the individual and for the business. And as long as that's in place, then it works.
I mean, with 1 million customers served, and I would imagine, that's just the first 5 years. I would imagine you expect the program to continue to grow, and, maybe 5 years from now, we'll be talking about you having served 5 million customers. But I'm so excited we got a chance to chat about this today because, like I said, it's a benefit to pets, it's a benefit to pet parents, it's a benefit to veterinarians, all for, varied reasons. But, it's ensuring better health for the pets. It's ensuring greater accessibility and affordability of care for pet parents. And for vets, it's, allowing them to continue to express their passion. I know we're just about at time here, but I would ask one last question that I've had in the back of my mind the entire time. I think a lot of pet parents, when they think of Chewy, they think of a place where they go to buy food and toys and treats for their dogs and cats. Do you get a lot of nutrition recommendation questions on the platform?
Yeah, nutrition's definitely something that people use our service to ask about. Nutrition's such a broad term, right? That can be something as simple to a vet, maybe not simple to a pet parent, as what food should I feed my new puppy? Or my dog, I heard that my dog is going to be a senior soon. Do I need to think about switching them to a senior diet? What's that all about? And then we get the more complicated questions like, I have a pet that's on kidney disease and I heard he should eat a protein restricted diet, or, my vet recommended a vet diet. And I'm just curious what the differences are, because I see you mentioned Hills, and there's this other brand, Royal Canin, and there's Purina. And so, when we talk people through, we answer questions about all of those things. But yeah, and nutrition comes up in skin conversations. Nutrition comes up in gastrointestinal upset conversations. So nutrition is definitely a core foundation of a lot of conversations.
Yeah. Well, I mean, it's so cool to see, Chewy building out the ecosystem. I'm really excited. We were talking at WVC about potentially me visiting the Austin clinic later this spring. So I'm hopeful I'll get a chance to see the clinic in person. And I was really impressed by what I saw there at WVC, and the focus on pharmacy and Care Plus, and Connect with a Vet sits at the center of that. You have a lot of tools at your disposal to be able to make nutrition recommendations, refer people over to get pet insurance, and refer people to seek actual clinical care. But like you said, I think it all. I think the one thing most people would tell you, in addition to Chewy being the place that they go to buy food and toys and treats for their dog or cat or other pet, is the phenomenal level of customer service that Chewy and that's been evident throughout the conversation today, and that's very much a core tenet of what Connect with a Vet offers. So thanks so much for taking the time to chat today, and congrats on the 1 millionth customer, and looking forward to potentially reconnecting when you hit 2 million.
Yeah, I would love that, Peter. I think that's fantastic. And yeah, I mean, we're all about putting our customers first in everything we do. And it's just been such an amazing privilege for me to be part of Chewy and part of the Connect with a Vet team as we've built this service out. And I'm just really excited to see how we continue to grow and develop as a business and serving our customers. So thank you so much for the opportunity. It's been great.
No, I've really enjoyed the conversation. We'll have to. I'm looking forward to more heartwarming stories of how Televet helped people out. Like you said, when a person's facing a decision about a 4-hour drive, you definitely sometimes need that extra bump to go. So, especially for people who are in areas of the country that are underserved or unserved by vets, it's an amazing service for everybody, but particularly for those people that don't have good access to care.
Yeah, or for those folks experiencing, unprecedented times, the wildfires in California, the hurricanes. I mean, Connect with a Vet was there to support during those times. We actually opened up our video service free to those pet parents in those locations. Just again, because those are times that are unprecedented. People don't know what to do. They're finding, veterinarian offices are closed, they're evacuating. And so, yeah, I mean, just again, it's all about being there to help and support and increase access to care when people need it the most.
Yeah, yeah, I'm glad you brought that up, because yeah, you don't think about it until it's happening to you. But no, that we continue to see these extreme weather events, and They're probably not, the last 5 years have been any indication, they're probably not slowing down anytime soon. So, it's great to give people those resources because they're already going through enough in those times. We were out at Pet Connect in Los Angeles in December, and I met with Peter, Alex, and Lisa out there, and it wasn't a month after that we're looking at Hollywood burning, and you can't imagine what those folks were going through, and from a basic humanity standpoint, but animals are affected too, and making sure that we can do whatever we can to help people get through those situations, including providing for their family members, their furry family members. That's really critical. So yeah, that's awesome. Thanks for sharing that.
Yeah, of course. Oh, my pleasure. This has been great. Really enjoyed our conversation. Thanks again.
I did too. I did too. Well, on behalf of Dr. Chris, everybody, I'm Peter Kenseth with Petworking. Thanks so much for taking the time to join us today. And if you haven't been one of the million people to be served by Chewy's Connect with a Vet, you can hop on chewy.com, go to the services drop down right in the middle, and Connect with a Vet is right there. You can access the free chat, book a video visit, and add it as another tool in your pet's healthcare toolkit, because oftentimes we need that bit of advice, and this is a great resource that Chewy's providing for everybody. So go check it out. And Dr. Chrissy, congrats again on the 1 millionth visit. Doing great work, and it's a pleasure having you on today.
Thanks. Thanks, everybody.
Thank you. Take care, everyone.